All right, hello, and welcome to our panel, Seen Unseen, Substance Use and Sex. I'm going to start by, my name is Peter Hong. I'll be moderating today's session, and today we have a panel of 3 speakers. Unfortunately, our 4th speaker couldn't make it today, but I'll start by introducing our first panelist. His name is Dane Griffiths, and Dane is the Associate Director of the Gay Men's Sexual Health Alliance of Ontario. He coordinates the planning, implementation, and evaluation of gay men's health campaigns and knowledge transfer exchange activities to strengthen the response to gay men's health in the province. So please give me a hand in welcoming Dane.
Awesome, thank you, Peter. Good afternoon, everybody. I have to say, having started sort of my journey doing gay men's health work, volunteering for an ASO around 7 years ago, I always was really envious of everyone who was able to attend the summit, and I would read the reports, and I would follow, Twitter and everything that was coming out of the summit. So to be able to be here today, not just participating but presenting, is a real privilege. So I want to start by thanking the CBRC and the organizers of this summit for the opportunity to be here. So today I'm going to provide a brief overview of a project that is still very much in its infancy for the Gay Men's Sexual Health Alliance, a provincial project responding to party and play, sexualized substance use among gay, bi, queer men in the province. So just briefly, for those who may not be familiar with the Gay Men's Sexual Health Alliance, we are a provincial alliance that consists of HIV service organizations, researchers in gay men's health, public health, policymakers, and others with interest in advancing the health and well-being of gay, bi, queer men across the province. So we're what's known as a priority population network, and so we play, our provincial office plays a supporting role for our stakeholders in the delivery of programs, services for gay, bi, queer men. There are other priority population networks in the province. We have a women's HIV/AIDS initiative and an African, Caribbean, and Black Council of Ontario, which is also a PPN. So I think there's just an important distinction there that we're not a service delivery organization. We don't provide testing. We don't operate clinics, but we work with folks who do. And all of our efforts align with Ontario's HIV Action Plan that emphasizes priority populations, of course, gay, bi, queer men being one of those, and a strengthened systems response that ensures more seamless engagement in the prevention, treatment, and care cascade. We support capacity building among members of our alliance who are based in ASOs across the province to strengthen their individual and collective response to HIV and sexual health among 2GBQ men in Ontario. So we do that by facilitating and supporting networking among alliance-linked organizations, knowledge sharing and skills building. Similar to CBRC, we host an annual conference in the province. And we develop educational resources that support the scaling up of promising interventions. We work with our partners to deliver relevant and timely information, trainings, coaching, intervention replication and scale-up, as well as campaigns around a variety of issues in our gay men's community. So there's a few examples of our campaigns there. I'll just give special attention to the one in the middle, which was the Sex You Want, which is really a cornerstone of our work. It was a significant project communicating combination HIV prevention. In the case of Party and Play, we're seeing increasing attention among some of the organizations we work with who are really leading the way in the delivery of interventions. And so we hope to learn and adapt those interventions across a diversity of contexts in the province. And that's really how we're envisioning this campaign, this project, Party and Play Your Way. It's not simply information sharing, it's a set of interventions that will roll out over time to address what we feel are unmet needs for gay men who P&P. And I would say that largely we are playing catch up to what has long been changing drug use trends in the gay men's community. And this project is a tailored and intentional effort to engage what is really, I think, a very marginalized group of guys in our community. So Party and Play Your Way, I'll just touch briefly on sort of the Ontario context. We continue to have a concentrated epidemic of HIV among gay bi queer men in the province, with year-over-year increases in ST-BBI incidents and no considerable decreases in HIV incidents in the province. It's worth noting that gay bi MSM who inject drugs have the highest positivity rate in the province when testing for HIV. And preliminary analysis from projects like iCruise and EMIS, which I won't touch on too much because we're going to hear more about that after, demonstrates that PNP is occurring across the province, not just in urban centers, among primarily gay-identified men across age groups, with a higher prevalence among gay men living with HIV and gay men who take pre-exposure prophylaxis. And I would say I don't necessarily think that this is a hidden population. Guys self-report accessing sexual health services, whereas many of those services would say that they actually don't see gay guys who P&P. I think it actually has more to do with culturally competent care and asking the right questions during assessments, for example. And so that's a real missed opportunity and one that we hope to address with this project. So why PNP? I don't think this will be news for anyone here at this conference, but party and play or sexualized substance use is associated with a range of negative health outcomes that include, but aren't limited to, the acute effects of some of the drugs, overdose risks, physical and psychological harms, and we have decades of research demonstrating the association between party drugs, mainly stimulant drugs like crystal meth, and HIV seroconversion. There is an exacerbated risk for HIV and other STIs, notably hepatitis C, that results from some of the ways we use drugs, so for example, injecting or slamming. Stimulant drugs are impacting gay men's engagement in the HIV prevention, treatment, and care cascade. So generally in the province, gay men are doing really quite well in the cascade. And when you look a little deeper at maybe who isn't as optimally engaged, it's primarily younger guys and gay men who use drugs. And this does have an impact on not just HIV treatment adherence, but PrEP adherence as well. And I would say, we talk a lot about 90-90-90 and sort of these UNAIDS targets. I don't think we'll reach 90-90-90 without focused and intentional efforts to impact what some guys may experience as problematic substance use. And just to add to that, harm reduction in the province has largely not been delivered through a gay lens. And that's an important consideration if we are to provide more relevant harm reduction programming to gay men. And of course, the impact of syndemics or these overlapping psychosocial health challenges that gay men experience that increase our vulnerability for HIV. Colleagues like Barry Adam, Trevor Hart, who I see in the room, research for years now has demonstrated the impact of syndemics, with substance use being one of those. And so service provider capacity across the province can be quite limited with these. So we're taking a multifaceted approach to this campaign, and I would say that we're looking to impact not just the health of gay men at the individual level, but also to address the structural and systemic challenges for guys who P&P and accessing relevant supports to maintain and enhance their health. I'll touch on a few of these today, mainly our web portal, training opportunities, but we're also looking at the establishment of peer networks to reduce isolation among gay men who P&P, social marketing, piloting of innovative interventions across the province, and all of our work will be evaluated so that we can measure the impact of what we're doing in the community. This model, I'm sure, is familiar with a lot of folks. It imagines behavioral change through a series of stages, and so we would hope that our project resonates with gay men wherever they are, right? So that might be imparting harm reduction knowledge practices for gay men who use drugs to enhance sex, resourcing our alliance network with the skills, the knowledge, and the resources to have conversations with gay men who P&P, increasing their confidence to engage with this diverse subpopulation of gay men. And when someone is prepared to take action in their substance use, we want to support more informed choices and a more seamless connection to peers and providers across the province to address some of those access issues. So partyandplayyourway.ca. This is just a very small sneak peek at some of the creative development we've been working on. This will be the community-facing campaign website. It'll launch in English and French, and will maintain the same progressive, sex-positive approach, which has resonated in our previous provincial campaigns. It is informed by research, including colleagues like Rusty Soltomayev, who interviewed 30 gay men in Toronto who PNP, and his qualitative work has been really impactful for this project. So throughout, we have quotes from guys who have, it's found its way into the content that reflect both the rewards and also the risks and challenges that can often accompany PNP. Some of the highlights include videos on safer injection practices, certain drug combinations. We have infographics, things like how to host a sex party, for example, web copy, and again, quotes from guys with lived experience that speak to contemporary issues in gay men's lives. We'll include both factual information on important topics like GHB overdose prevention, which has been getting, I think, increasing attention, particularly in the city of Toronto, safer injection practices and drug interactions, as well as the links between substance use and HIV, STBBI risks, as well as often unspoken subjects in the gay men's community like consent. This website will be really a cornerstone of the project. It'll be enhanced over time with a series of resources, links to interventions, and more. And we're also looking to adapt this campaign for other diverse subpopulations of gay men who PNP, for example, Black queer men. We feel that a multidisciplinary response to PNP is needed in the province of Ontario. You can see here in this model, each of these stakeholder groups collaborating together to address PNP would see more synergy in our efforts to improve gay men's health, and it presents, an inordinate number of training opportunities. Across each of these stakeholder groups, we think there's opportunities to improve knowledge, foster more progressive attitudes to both sex and substance use in our community, and increase the skills and confidence of these providers. So one specific example, we're looking to implement a motivational interviewing training program for our alliance-linked organizations, including learnings from a previous MI project funded through PHAC a couple of years ago now. So MI has a wealth of evidence for its use supporting gay men who use drugs. It's a counseling approach, but it's also a set of adaptable skills that we think can be utilized across the work of some of our ASO folks. Party kits, I'll touch on this briefly. We were really inspired by a group in London, England called the Gay Men's Health Collective. This is a group of gay men who, in the absence of healthcare organizations responding to the harm reduction needs of gay men, developed what they call PIP packs, which are very small boxes that contain everything you would need to practice harm reduction in a sex and substance use setting. And so we were really inspired by that work and pleased to share that we'll be piloting the development and delivery of 3,000 kits across the province in collaboration with the Ontario Harm Reduction Distribution Program, engaging peers in the development of those kits and evaluating their impact and how much they resonate with gay men across the province. This is a quote from a member of our advisory team who we've been engaging with, who said that right now there's really no resource in Ontario that supports the nuances around this particular group of gay men who are sort of hidden. There's the legal context, but there's also trauma, shame, internalized homophobia. There's a lot of emotions that are the base of some of these challenges. They're concealed, they're hidden, and they're not given space. So through our efforts with this project, we hope to give and create space to what we feel is a defining health challenge in our community right now. We see this as a long-term investment over time. It won't just end with the launch of the website. And we have a big tent vision for this project in the province. And so if I've piqued your interest today with this little sneak peek, we would love to hear from you. Finally, I just want to thank the GMSH team for their support, our project advisory team, made up of stakeholders and from across the province, and all of the gay men who have so far and who I'm sure in the future will support us through sharing their lived experience of P&P, their stories, their resilience, and their knowledge. And I hope to be back next year to share some of the outcomes and some of the progress of this project. So thanks so much.